Hi there, my name is Beth Carr. I'm a senior physiotherapist working in St Francis Hospice, and thank you for the opportunity to talk today. This study I recently undertook as part of my Masters in Cancer Survivorship, so looking at a 4-week exercise intervention and whether that improved physical functioning, fatigue and quality of life in patients with advanced cancer under the care of a specialist palliative care team. So exercise rehabilitation, as Rebecca's been talking about, is a really beneficial component in the management of symptoms for patients with advanced cancer, and in particular fatigue and reduced physical functioning. And the reason I decided to complete this study, because at present we run a number of different exercise interventions in St Francis Hospice for different symptoms and conditions, and they typically last about 5 weeks in duration. But none of those actually focus specifically on fatigue. And we know that a large number of our patients report significant levels of fatigue. And the evidence supports the benefits of exercise for improving the symptoms of fatigue and thus then quality of life. However, the optimum type and duration of exercise remains unclear for these patients, and this particularly for fatigue. And we know that a lot of the studies that are completed actually last for 8 or 12 weeks or even longer at times. But actually, in practice, we know our patients struggle to even attend for a 5-week program. And so what we wanted to do was look at, if we ran a shorter program, could we see any changes in those outcomes over that period of time? And I think it's important to note that in a palliative care population, we might not always see improvement in physical functioning, but actually if we can see maintenance of symptoms, that can actually be a positive outcome where you've got patients with a deteriorating disease trajectory. An improvement or a positive outcome could be just a maintenance of symptoms or where they're at. So the aim of this study was, like I say, to investigate the effect of a 4-week, it was physiotherapy-led exercise program called Energize, on physical performance, fatigue and quality in life with patients with advanced cancer. And we also then ran focus groups to see the patient experience of attending Energize. So exactly what is Energize? So patients with advanced cancer, obviously, and it was limited to that just as part of my master's, who had a self-reported functional impairment and fatigue were eligible to attend. It was a 4-week program led by physios, twice weekly, circuit-based exercise program with the focus on aerobic and strength-based exercises. Like I say, we completed post-program focus groups to gather patient experience of Energize, and we also looked at attendance of patients coming to Energize. So the outcomes measures were taken in advance of starting Energize at midway, so at 2 weeks, and also within completion of Energize, but within 2 weeks of completion, we didn't leave it to go on any longer. And as you can see, there's a number of different outcomes that we looked at. So for physical performance, we looked at grip strength dynamometry, the 5 times sit to stand, 1 minute sit to stand, and timed up and go. And this was to make sure we were looking at strength, endurance, and functional capacity for these patients. And then for fatigue, we used the multidimensional fatigue inventory, which looks at 5 different domains of fatigue. So general, physical, and mental fatigue, reduced activity, and reduced motivation. But this also gives you then a combined total score as well. And then the EORTC QLQ C15 PAL was used to assess quality of life. So this flow diagram shows the flow of participants from identification of potential participants all the way through to completion of the program. And as you can see, we started with 17 potential participants, but we actually ended up with 5, which again is not uncommon in a palliative care setting. However, it's really important to note that nobody dropped out due to burden of the program or dislike of the program. All fallout was due to medical instability, progression of disease, or admission to hospital. So all of those patients who didn't manage to complete it were all for very valid reasons. So what did we find? So just to note, we didn't complete statistical analysis because it was such a small sample size, but we did complete descriptive I can never say descriptive statistics. And as you can see in brackets there, these are the mean values that the changes. And we found improvements in every outcome that we looked at within 4 weeks, which is really positive. So for 5 times sit to stand, for those non-physios, particularly in the room, we're looking at how quickly they can stand up and down for 5 repetitions. And there was an improvement of 1.8 seconds. For 1 minute sit to stand, so again, the number of sit to stands you can complete in a minute, there's an increase in 2.8 repetitions. Timed up and go, I'm going to describe a bit more in a minute, but there was an improvement of 1.4 seconds. Grip strength increased by 3.92 kilograms. Fatigue, so again, I've just used total fatigue in this example, but reduced by 21.8. And quality of life improved by 13.34. So all good and positive outcomes. It's really interesting to note that none of our patients actually attended for all the sessions in the programme, and the average attendance was actually only 65%. Again, this is fairly in line with most of the literature and what you see at attendance at these programmes, but the reasons for non-attendance was hospital appointments and ill health, which again, we would expect. So the focus group findings, we had 2 main themes that identified. So concerns in engaging in Energize and the positive experience of Energize. So from the concerns in engaging in Energize, the sub-themes that came from that were appointment and symptom burden. Again, normal things when it's taking part in exercise, and actually challenges with transport, which I'll be pleased to say we managed because we have a great transport service in St Francis Hospice. And then the positive outcomes were physical and psychological improvements, the benefits of taking part in a supervised exercise program, the peer support they received from attending a group program, and also the environment, and they're really positive about the environment in the hospice space. So I've just picked a couple of outcomes to just talk in a little bit more detail today, and this is the timed up and go. So again, this is a measure of functional ability and dynamic balance. So participants are asked to stand up, walk 3 meters, turn, walk back and sit down. And the lower the time is a more positive outcome. So you can see here all the participants improved from pre-assessment all the way through to completion of Energize. And these findings were supported by the results of the focus groups. So since I've been coming here, my level of falling is minimalised and is practically 0. And I used to hold on to my chair, and when I sat down, I'd plonk onto my chair. Since doing the exercising, I've found such a difference. I can actually sit on my chair. And then the other outcome I just thought I'd go into more detail, in particular, was the fatigue. So again, you can see there was an improvement in fatigue from pre-assessments, the pale blue bar, to the dark one. And again, they improved at every outcome, particularly the last participant had a great improvement. So again, this is supported by the focus group findings. I definitely have a boost of energy, 100%. And I had a lot of fatigue and was sleeping a lot, but it really gave me a boost coming to the class. So what does this mean? So it's a really positive finding that we could see changes, so reductions in fatigue and improvements in physical performance and quality of life in just 4 weeks. So a very short time frame for a lot of these things. And shorter interventions may be more suitable for patients with a high symptom or appointment burden who are struggling to attend those longer programs. It's really, really easily replicable. You literally need a physio, a bike, and some dumbbells. And it's suitable for a range of advanced cancers. So just to name a few that we had in the program, we had patients with pancreatic cancer, glioblastomas, leukemia, prostate cancer. So there was a real range of cancers within there, but it's likely to be suitable for all conditions that we see in a palliative care setting. So there were group settings. We ran it over both sites in St Francis Hospice. We had a group in Raheny and a group in Blanchardstown, but yeah, they were group sessions. We allowed for an hour, but it was also incremental, so it kind of increased over time. So we did progress it through time, but also weights depending on patients' ability. But we allowed an hour. No, so by the end we had 5, but actually we started off. Can I just go back and I'll get my numbers correct here? So 10 of them commenced the program. So we'd lost 7 by the time we even started the actual exercise program. But by the end of it, we only had 5. And they kind of dropped off gradually throughout. And that was because of changes in symptoms. And like I say, a couple of them were even admitted to hospital. So we didn't specifically invite the carers in as part of it, but, hopefully with education to them, we did manage to get them on board. Again, some of them had more family support than others, as you know, but they were all given a home exercise program and a home exercise diary. We didn't check that. We didn't make them bring it in, but it was for themselves to be able to track and just try and keep them accountable.